Can you please give the warmest, most excited Day 2 energy applause to Dr. Stacy Williams and all of our panelists? Come on up stage.
Good morning, everybody. It is great to see all of you and great to be here with this panel of collaborators from our private sector. So I'm going to allow that panel to introduce themselves, but I really want to spend some time today focusing on that collaboration piece. So Dr. Amir, once you're seated, I'll have you go ahead and start with our introductions today, sir.
Thank you very much. Thank you for the invitation and thank you for your service. I am Guillermo Amir. I'm a professor in the Department of Biomedical Engineering and the Department of Surgery at Northwestern University. I got my doctorate degree from MIT. I'm a chemical engineer by training, so you don't want me to cut you open or resuscitate you in an airplane. You don't want me around. Maybe I'll watch and see. But I was very much interested in how can we apply engineering principles, specifically chemical engineering, to healthcare problems, to medical problems. So I got interested in materials, so we do biomaterials work in our lab. I'm part of a new field that is super exciting. It's called regenerative engineering. And talking about AI, regenerative engineering has subfields within it. One of those is going to be regenerative AI, interesting enough. So we have a Center for Advanced Regenerative Engineering at Northwestern that I direct. I'm the founder and director, and it's a pleasure to be here with you to help talk about collaborations and how do we create new technologies.
Fantastic, thank you. And Dr. Argal, what can you bring to our arena of collaboration here today?
Sure. My name is Brenna Argal. I'm also a professor at Northwestern University in computer science, mechanical engineering, and physical medicine and rehabilitation. Like Dr. Amir, you don't want me actually involved in your healthcare decisions directly because I'm a roboticist. My PhD is in robotics from Carnegie Mellon University. When I joined Northwestern, I was hired to start a lab in rehabilitation robotics, which was a new area for me, actually. And so a challenge that I was tasked with, which was how to bring the training that I had in autonomous robotics and robotics intelligence and robot learning to the space of human rehabilitation. My lab is located inside of a rehabilitation hospital. It's called the Shirley Ryan Ability Lab. It was formerly called the Rehabilitation Institute of Chicago. It's just a couple of blocks away from here. It's actually the #1 rehab hospital in the country, but even more important, I'd say, than that is that it has pioneered this innovative ability lab space where it is open plan between research and clinical practice. So the students in my lab are literally programming robots steps away from inpatients in our hospital who are 3 days out of the ICU and receiving their physical therapy. So within my lab, we focus on how to make assistive devices more accessible to people through the use of intelligence, artificial intelligence. What became clear when I started my lab was that the greater gap was not the mechanical capabilities of devices like wheelchairs and robotic arms. It was the ability to control them, especially when you have a motor impairment yourself. So we look at how we can do a better job of interpreting the control signals that we get from people and using intelligence and robot autonomy to bridge any gaps that might remain in their ability to control the device.
Wow, that's a lot.
Very smart. Very, very smart.
That is amazing. And so, Dr. Colgate, you have a tough act to follow there.
I sure do. I have a very tough act to follow with both of them, but I'm used to it because Brenna and I have offices just a couple doors away from one another. I'm also a professor at Northwestern in mechanical engineering. I'm also a roboticist. I did my graduate work at MIT, like Guillermo, and 36 years ago and change, joined the faculty at Northwestern. Through that career, I've focused largely on the problem of physical interaction between people and robots. I've worked on this in a variety of different ways. Had the opportunity early in my career to work on and really develop this field that today is called cobots, collaborative robots. The idea of people and robots working physically together to complete tasks that would be challenging for either one alone, usually because it would be physically difficult for the person and usually intellectually difficult for the robot. So bringing those things together. I had a great opportunity in the middle of my career to work with DARPA and VA on developing advanced prosthetic limbs. And fast forwarding to today, I am the director of a really new center that's being led out of Northwestern and involving a number of universities as collaborators. This center is funded by the National Science Foundation, and it's called HAND, Human Augmentation via Dexterity. And our vision in this research center is to really democratize access to robotic manipulation, which today is, robots are quite advanced tools, they're very expensive, they're very difficult to use. Our vision is to endow robots with very versatile, very highly functional hands and great interfaces to them that would enable you or me, without any expertise in programming a robot, and I actually don't have very much of that, I like Brenna, to put those robots to use, to use them in the home, in the factory, in a wide variety of settings. This is a big challenge, but it is these advances in AI, generative AI, which is Brenna's expertise. Brenna is part of our team and actually leads the effort in machine learning for robot hands. It's these advances which make it possible for us to even conceive of this challenge today. So I am super excited to have this opportunity, and I will say it is all about collaboration. The challenge here is so multifaceted and so difficult that it takes not only a wide variety of technical skills, but really a wide variety of collaborators across a broad ecosystem to understand really where to drive these technology developments.
Fantastic. As you can see, we've brought you the best. So I am really excited to hear a little bit more about collaboration. So I'm going to just toss this open to the panel for whichever one of you would like to jump in and answer first. But how do you, in your role, and you all have very fascinating projects that are out there that all could have impact on our roles within the Department of Veterans Affairs. So how do you all collaborate in your roles, and who are some of those frequent collaborators that you interact with?
Yeah, do you want to go first?
Either way. Okay.
Go ahead. It's a tough act to follow, but go ahead. Go ahead.
So, of course, as an academic, I collaborate with other academics, but I would say some of the more interesting collaborations I have, not that my academic collaborators aren't interesting, but I've recently begun a collaboration with industry. So there is exactly one company out on the market that provides an aftermarket solution that's sensor-based safety system for powered wheelchairs. So it'll stop you from drop-offs, from going off of curves, and also from colliding with obstacles. We have an NSF award together under a program that is entirely about translating technology or translating advancements out into the real world. And so through a partnership with this collaborator, with this company that's called Lucy, it's going to be the case that now some of my lab's work will actually make it out into a commercial product, make it out to the real world, which is very exciting for us to see. Part of that is getting really great information from our end users and our clinicians, and those I would say are actually my favorite collaborators locally. So I'm privileged to have my lab inside of a hospital, so there are a lot of clinicians that I have access to, occupational therapists, physical therapists, doctors, nursing staff, you name it. And that's really excellent. But also our end users. We have a big patient pool of even former patients who are interested in being involved in research. And I'll just highlight one of my, one who's very special, I'd say. Michelle Lee, so she started out in my lab as a research participant, but actually had not driven our robotic wheelchair. She was doing an interface study. Started out as a research participant, came back to my lab because Fox 32, a local news station, was doing a segment on my robotic wheelchair work. It was the first time she actually drove our robotic wheelchair. Through that, she said, please contact me for further studies. Lucy, this collaborator from industry that we have, was at my lab over the summer. We brought her in, they put a Lucy unit on her chair. She's now gonna be a Lucy beta tester, which means she's gonna get early rollouts of Lucy software updates, including the work from my lab that's going into her chair, or that's going into the Lucy product, and it's gonna be on her chair through, and all of the Lucy beta testers starting this winter. She also, because she trusts us and because she's an awesome collaborator, and she's also an advocate, she works with the Chicago Transit Authority, on access for within transportation. She's just a fantastic person, but she wants to share with us all of her data. And this is going to be a remarkable opportunity, not just for my lab, actually for the field as a whole. Because when you have a safety critical system like a wheelchair, it just is not practical to send that device home with people and have them evaluate it in their day-to-day interactions. It's certainly not at scale. But because we're working with this company that has developed a safe product that aligns with FDA regulations, and because we have people like Michelle who want to see that technology advance, suddenly we as a field are going to have access to this real-world data for the very first time.
Yes, so I mentioned that I'm a chemical engineer by training, so I know nothing about medicine originally. So it's very important to have collaborations to do what I do. So I want to start with defining this field of regenerative engineering. It is effectively the advances within the last 10 to 15 years in material sciences, stem cell and developmental biology, physical sciences, data sciences, specifically AI, and clinical translation for the development of scalable tools that will enable the regeneration of tissues and organs. So I am passionate about how can we help our body heal, how can we unlock its potential to do better. So as a result of that, I do definitely need extensive collaborations with a variety of different types of disciplines. So as I said, it's a convergence of these different fields. And what is convergence? It's when you bring or you integrate disparate fields that you think have nothing to do with each other. You bring them together to solve grand challenges, meaning that you need novel solutions, you need innovation. So what I've done in my lab when I first started, I don't know, not 30-something years ago, but maybe more like 20-something years ago, was to identify like-minded surgeons and clinicians. I'm interested in how do you improve the outcomes of surgeries. So I partnered with a vascular surgeon, an orthopedic surgeon, back then in my earlier days as an assistant professor. And the idea was how do I help them do their job better? How do we improve the outcomes of connecting a blood vessel back together after you have to cut it, or if you remove plaque from systemic atherosclerosis? How do you, in the case of orthopedics, how do you reattach soft tissues to bone? How do you regenerate bone tissue? If you lose a limb, you lose a finger, an arm, how could you design complex tissues that you could now reattach, right? We have a shortage of organs, as you know, unfortunately. How can we perhaps use organs that would be deemed not usable, right? Can we recondition those organs so that there's more availability and we don't have to necessarily use the organs from animals? So in that process, you have to understand their language, you have to understand their system, which is very different from that of an academic engineering school. In doing so, you learn about what are their real challenges. You embed students. My main job is to train the next generation of engineers and scientists. So convergence is a matter of how do we train people to enable them to do those types of collaborations to come up with solutions. So as a result of that, let's fast forward 20-something years in the future to today. We also discovered in my quest to do these things, regenerate tissues and organs, we've now done work where we are looking at patches for your heart, so that if you have a heart attack, if you're recovering from that heart attack, you typically have abnormal remodeling that leads to enlargement of the heart, and over time, potentially heart failure. We're working together with collaborators, Professor John Rogers is an example, to have these patches that can sense if you have a misfire, for example, and then can correct that. But not only that, can help prevent the development of scarring, right? That's what leads to these failures of your heart. In the area of skin regeneration, we are working to prevent or to improve the rate of wound healing. In the case of diabetes, we have a very high epidemic of incidence and prevalence of diabetes. The idea is that you can't heal as well. All of these devices that we talk about, when you put them in your body, they do a lot worse than when you don't have diabetes. So we've done work in skin regeneration, soft tissue reattachment to bone. We have devices on the market that are biodegradable, meaning that instead of using a metal screw to reattach your ligament, your tendon back to your bone, they use these screws that are actually made out of a new polymer that we developed based on citric acid, something that's commonly used every day in our lives, together with ceramic. And what happens, our body remodels that into normal bone, natural tissue. So the idea is to do away with these metal screws that simply can give us side effects, beeping up through airport metal detectors and so forth. So in order to get that to the market, so that now, as I said, thousands of patients have these devices in their ankles, mostly in their knees, we had to work with industry. So to your point, industry was a partner from the beginning in order to learn, again, I had to learn a new language, new lingos, how do they operate, and get that technology out of Northwestern University, out of my center, out of my lab, into their hands. They have to reproduce and validate what we've done, and that process is also collaboration. So you collaborate with clinical people and researchers. We collaborate with other engineers, Professor John Rogers, for example, in the case of the bioelectronics, where we can sense things and actuate things, right, on demand. We also collaborate with industry, and they collaborate with the FDA, right? So that's an example of, in my area, my field, how we try to identify the needs, work with people from very different areas other than mine, and then try to move product technology forward.
Wow.
Yeah. Note to self: don't answer last. These two, I think, gave just beautiful answers, and I think you get a sense of the wealth, the variety of different collaborations that are critical in their work, and I guess I would like to sort of build on that and give more of a meta answer. Early in my long career, collaboration meant teaming up with one other professor, usually someone in my field. And that wasn't actually that common. And in my case, I actually joined forces with another professor. We had separate labs, and we literally tore down a wall between our labs and began to collaborate. And that actually was very generative. It led to a lot of great work, and I think to better training of our students. But that was a long time ago. The world has changed so much. The challenges that we face are so complex and so multidisciplinary that it's critical to cultivate a broad set of collaborators. And to be able to work effectively with them, which, as Guillermo talks about, means learning their language, learning their values, and this can be extremely challenging. So I guess as I tackle in my career sort of larger and more diverse collaborations, frankly, I'm constantly seeking a better understanding of how to make those things work well. How do you get people from very different areas of expertise to come together and work effectively together? And honestly, I haven't found a magic bullet. I don't think there is one. I think it's a commitment to spending time together, to talking together, most of which today happens on Zoom. And Zoom, by the way, is not a silver bullet and not the answer. What you're doing here in this couple of days is far more critical, right? What happens when you get together and you're in that same embodied space together is so important. The other thing I'll say is that as we tackle these broader and more complex challenges, the reach of or the diversity of your collaborators, I think, has to grow and grow and grow. So in this center that I'm now running, I'm collaborating really for the first time in my career with social scientists and people interested in policy and economics, right? Because we're working on building advanced robots that could have negative impact, right? That we hope will have great impact. But the challenge is how to look into the future and understand how to guide those impacts in a way that's broadly beneficial. And understanding that at the same time, when you start letting the genie out of the bottle from the standpoint of technology, as we're seeing with generative AI, it becomes so critical to have guardrails and policies in place that help ensure the proper use of that technology. And so in this situation, here I am in frequent meetings with folks who are thinking about economics and policy, and I know nothing about this. And so, once again, it's critical to spend the time to listen, to learn, to ask questions, and frankly, to show a lot of humility. I think humility is probably one of the most valuable skills that a collaborator can have, especially in this day of really large and complex collaborations. So I'll shut up there, but I just wanted to comment on sort of the changes that I've seen in this.
So when you hear all of these answers, think about your own practice at your medical center, at your program office, the challenges you face, and the experience that these panelists have that may impact your own work. So thank you for sharing the broad variety of opportunities that you've had to collaborate, and how giving us a roadmap, so to speak, of how we can collaborate ourselves. So can you tell us a little bit more about how you actually built that environment that made it open to collaboration within your community? And Dr. Colgate, since you were like, oh, I've been to last twice, how about you start with this one?
Absolutely. Absolutely. This way, things will just get better and better. Yeah, so again, I'll speak about this recent center. It's the thing that's been driving my world for the last couple of years. The process of writing the proposal and getting the funding is a couple of year-long process, and all that's happening in that couple of years is building collaborations and building community. And then once you actually win it and get the funds, well, then you got to continue to really build those bonds. How do you do that? Again, as I mentioned earlier, I think there's no silver bullet, but I think it's critical to find ways to come together. It's critical to empower people, and as a leader building collaboration, it's really critical to trust your collaborators and your team, to give individuals on the team the autonomy and the authority to pursue their own interests and their passions, even as you're all trying to come together. There's a tendency when you're trying to build a community, I think, to want to be a little bit directive. This is how it's going to be. But what I've found is that the collaborations build more robustly when the building of that community is more organic, when everybody has something to contribute to it. And that means, for me, sometimes it's a very uncomfortable feeling of not quite understanding what everyone is doing and why they're doing it, and not necessarily believing that it's aligned with what I'm trying to do, and yet having to sort of take the loosen the reins and sort of let that happen, let people build for themselves, and then yet we have to keep coming back together. As I mentioned, the reality is when you're building a big distributed team, and that's typically what they are in today's world, there's just a lot of electronic communication, a lot of Zoom meetings and so forth. And again, those go only so far. So I find it incredibly important, although it takes some tremendous work to find opportunities to bring this distributed team together in person, and to really put a lot of effort into creating an experience, which I see is happening here, by the way. In fact, I'm taking notes. I didn't really expect a dance party at the start of the day. Walked in and didn't really get it. Yeah. Now I got to learn about these puzzle pieces too, but you're clearly doing some extraordinary things in order to bring people together, to lower those guards that we all have, and encourage that collaboration, and that's so critical. And to me, it's about building a culture in an organization, a culture that enables people to bring their best selves and their best ideas to that organization, so that's a bit of a rambling answer, but it's something that's very much on my mind, and yet it's I think I'm a little bit in the weeds of it these days, so I'll shut up right there.
Yeah, I'll go next, and maybe I don't want to be controversial or anything, but I'll say this, DEI, in a different context. So I want to, if I have a problem to solve, I want to regenerate bladder tissue or your liver, pancreas. We have a grant pending with the DoD, hopefully we get it. I want to hear from everybody, right? And I need to build an environment that enables everybody to feel they have that right and that potential to chip in and give me their idea. I want to hear from assistant professors, the new folks that know the latest technologies as we recruit them into our labs. But I also want to hear from my more senior colleagues, such as Ed, who know a lot more than I do in terms of other areas, other issues. So that opportunity, that inclusivity, meaning I want to include everybody in my decision making. I want that diversity of opinion because, again, I need to hear from clinicians, I need to hear from policymakers, FDA are regulatory bodies, company, industry, they have their requirements. And then finally, again, diversity, equity, meaning that everybody should have the equal chance to be heard. Nobody's better than others, and that's the environment I try to and I aspire to create. Now, that said, it's also important to have contacts. Some of the best ideas that came out of my lab was running into my colleague, my office mate in the hallway, randomly. Hey, what are you doing? Are you a mechanical engineer, Cheng Sun? Yeah. What do you do? Oh, he does 3D printing, additive manufacturing. I know nothing about 3D printing. I do materials or biomaterials. I say, is there any way, as I have a problem, we were trying to develop better blood vessels to reconnect, to help surgeons reconstruct blood vessels and reconnect people. But the materials that we use today are just not that good. The off-the-shelf clothing, Teflon materials or whatever, Gore-Tex, just not good. And I say to him, we also have a problem with stents, where we use metal devices, and why do they have to be metal? We don't need them forever. We just need them to be temporarily there to help your vessel not collapse. Can we do better? And he goes, well, yeah, maybe we could print biodegradable stents. Maybe we could print better vascular grafts. And that happened through a random, I don't want to say collision, but encounter in the hallway. So I think, again, having that diversity, equity, and inclusion in mind, we don't want to exclude people. So all this talk about it, I'm from Panama. If people had excluded me, I would not be here talking to any of you. We would not have products in the market that are impacting tens of thousands of patients, right? In fact, Elon Musk is not from here. We wouldn't have Tesla if we excluded, So my point is that to create that environment, we have to hear from everyone, and we want to make them feel like they have the opportunity and the possibilities to collaborate and contribute. That's my 2 cents.
So one thing that I think can be helpful in building collaboration is if you have sort of a collective overarching directive. So it's somewhat easier in my area, I'd say, because, for example, with my collaboration with Lucy, we just want this assistive technology out there. Of course, you need to do things like academics need to publish, they need to be able to win grants, companies need patents, they need to be able to earn money, but there is space within that to still just try to advance the field forward. And one way that I think this shows up quite nicely within robotics is the open source community. So if you had developed a particular capability for your robot, it could perform some action, it could learn how to do something in a particular way, and you wanted only your robot and your lab to be the group that could demonstrate this functionality, you would never release your code open source. And there is a thriving open source robotics software community that has really advanced robotics around the world. And we've taken a page from this in this collaboration I have with Lucy as well, and we have come up with a digital API, a digital communication protocol for wheelchairs between the control interface that they're using and the wheelchair control system. So those of you who work in the space of wheelchairs perhaps know that currently the communication that happens between a wheelchair and your joystick or whatever input device you use, it's a 9-pin DB9 cable. It's a printer cable. And it is not digital, it's not bidirectional, you can't send any information back up the other way, and all of the capabilities that we've developed for USB and Bluetooth, not possible. So we've developed this protocol, it's called the Wheelchair Digital Interface, and we released it open source. We want it to be adopted by everyone. We want it to make it possible so that you can use your Xbox controller to drive your wheelchair, which, by the way, you can do, and we have Lucy beta users doing right now. And so doing that, I think, having that as your overarching directive, then it can sort of get conflicts that might arise on the side where people want to be perhaps a bit territorial or they want to claim ownership, there's space to do that in a reasonable way while still reaching for this overarching directive, which means that you collaborate quite well. Also, I meant to mention earlier, the VA is Lucy's #1 customer, so well done.
We know we have our innovators and our teams out there. We also know we have our HRO teams out there. When you heard all of these answers, didn't you think about our high reliability journey and deference to expertise? And I really think that that is very much highlighted in all of your answers across the board. So thank you for that, as VA is definitely on that journey to high reliability. So I'd like to kind of toss out this question, and maybe, it would be something that maybe just one of you wants to answer, or all of you, however you want to do this, but what can you all, as academic collaborators, can't talk apparently, academic collaborators, bring to VA or bring to the federal government? We heard about that VA-FDA collaboration before we all got on stage. So how can we partner with Northwestern or with our academic collaborators more effectively?
Maybe I can give this one a shot. So I'm the director of a training grant. So there are these opportunities to apply for funding to create a training program for students or postdocs or docs residents in particular areas. So I have one that's about regenerative engineering, right, and convergence research. How do we do this process to do better in terms of solving problems? And what we would love to be able to do, what we do in our current training grant, is require the students to have, first of all, 3 mentors: an engineer, a life scientist, and a clinical collaborator. They're also required to do an internship, what I call regenerative engineering practice school. They have to go out there for 3 months at least, 3 to 6 months, to spend time at a company, typically in the area of research, but that could be also at a lab. For example, we have collaborations with the United States Army Institute of Surgical Research in San Antonio, where they volunteer to be one of our partners to host our students so that they can physically see the wounds, see the trauma, see the types of challenges that we typically read about, right? You go to your computer, you read abstracts, you read introductions, but you don't really experience the smell of those wounds. You don't understand it. So I think academic collaborators can work with the federal government agencies, such as this institute, to help better train our students to understand the real challenges that you face out there in your practice, and come back to us, re-educate me and my colleagues and what they observed, and then we all learn how to do this job a lot better. That's an example of, I think, how we could do that.
I think one thing that could be really great for the VA to do would be to partner with academic institutions to do this sort of end user evaluations. So I mentioned in my first response how critical end users are to my lab's research. And my lab's very lucky that it's located inside of a hospital, and it is a bottleneck for research in assistive devices and assistive technologies within academia to actually evaluate on actual end users. The reason why it works for my lab is, as I said, I'm in a hospital, and I'm in a substantial hospital that's also invested in research. So the VA is sort of a one-stop shop health system. It's a huge health network. You guys have access to all of these end users, all of this clinical expertise. So if you partnered with academic institutions to try to collaboratively help develop and evaluate these technologies, I think it could be quite powerful.
Thank you.
Yeah, I think that Brenna's point is just spot on. In my career of collaboration, the collaboration with the end user population has always been so critical. Back in the early days working on collaborative robots, we collaborated very, very closely, not just with the automakers who needed these, but with the workers on the line. We spent a lot of time out in automobile factories working very directly with people on the line to understand exactly what their needs were. And that really had a huge influence on how the technology was developed. Later on, as I mentioned, I had a chance to work on prosthetics. Again, we worked very closely with the military, with wounded warfighters, really understood what the needs were, and that helped guide that work. Where we sometimes fail to meet as much success is quite frankly when we academics tend to retreat into the ivory tower. It's a comfortable thing to do. The more uncomfortable thing to do, and I talked about collaboration often being uncomfortable, is really to deeply engage with the other stakeholders. And the VA, I think, represents an incredibly powerful and important one. You know your challenges, you know your population. What we in academia can bring is a bunch of very, very creative people. I'm speaking about our students, and the energy and the knowledge of how to push boundaries. We can take risks. We can take the sort of risks that lead to tremendous innovation, but we can't do that effectively and productively and solve real problems without that deep engagement with you who deeply understand what the real needs are. So I've seen this again and again and again in my own work, and have failed to collaborate effectively because it can be very uncomfortable and very challenging. But I challenge you to reach out to academia, to even when it can be difficult, to work to build those bonds, because you'll find in academia just incredible innovation, incredible talent, and really that next generation of people who may make a difference in your lives and those of your community.
Thank you. Yeah, pretty awesome. So now I'm going to give you a little bit of a curveball and a fun question. If you look at all the people out there, many of us aren't from Chicago. I know I'm not. So if you want to give us a local recommendation for Chicago, we're here for another couple of days. We enjoy having fun, as you can tell by our dance party. And what's your favorite thing about Chicago?
Look at me first? Okay. So I would recommend the Green Mill, which is a jazz club in Uptown, which is a Chicago neighborhood north of here. It's the oldest jazz club in the country. It was a favorite of Al Capone. It still has the escape tunnels. You can't actually go to see them, but his escape tunnels. They play live music every night. It's like throwback jazz from the 20s, 30s, 40s. Great drinks, and so yeah, I don't know if that's my absolute favorite thing about Chicago, but it's one of, if not the favorite spots in Chicago.
Oh, thank you. That sounds like fun.
Yeah.
Sure. Again, it's really hard to top. Green Mill is awesome. Actually, I have a son who's a jazz musician. He lives in New Orleans, where there's also some pretty good jazz, but every time he's here, we head out to the Green Mill. But I am going to say that the thing that I love about Chicago is the neighborhoods. Chicago is a city built out of neighborhoods, each of which has its own kind of distinctive character. And you're close to some really cool ones. Just a little bit north of here is the Gold Coast, which is really nice, and Streeterville, and then Lincoln Park. But the neighborhood I'm going to recommend that you take an Uber and go out and explore is Logan Square. It was recently voted as one of the coolest neighborhoods in the world. And I have a second son who actually lives there, and so recently, he moved there recently, and I've been spending more time. And it's just great to go to Palmer Square Park in the middle of Logan Square and just get out and start walking around. There's an incredible farmer's market, there's restaurants, wonderful restaurants and coffee shops, and just a lot of kind of cool little kitschy culture that's uniquely Chicago. So get out and see some neighborhoods.
Great. So I agree. I think the neighborhoods are fantastic, and I think the beachfront, which you cannot enjoy, it's too cold, but it's fantastic in the summertime. But in terms of food, I would recommend Chicago Pizza and Oven Grinder in Lincoln Park. It's on Clark Street. Another reference to Al Capone, apparently. So there's some shootings in front of that restaurant, and there are bullets in the walls and things like that. But that said, they have a very different take on I'm not a deep dish pizza lover, but they have a different take on that. They've been around for, 50-something years, cash only. You have to form long lines, so maybe call it in, pick it up, and go back to the hotel. But it's excellent, excellent pizza, and the best salad ever that you'll ever have. You have to mix the two different dressings. You'll see what I'm talking about if you go.
Love it. So you've gotten recommendations to visit some of these awesome Chicago neighborhoods. I've been detailed here for a little while and I've been exploring some of them, so I'll agree. And a dance club and dinner. So you cannot beat a social activity here or a social evening here in Chicago this evening. So team, I really appreciate your time, and panelists. Most importantly, I appreciate the spirit of collaboration that you've brought here to our IEX this year. You truly do innovate Illinois, and we thank you for it. Thank you.
You're welcome.